Bryan Burklow is the CEO of EntelMed and has 25 years' experience within the healthcare industry, 15 of which he was a chief executive officer at organizations such as Prime Healthcare, Community Health Systems, and Merit Health. He is a highly experienced executive officer who is renowned for his ability to revamp failing hospital systems. Without further discussion, here's my conversation with Bryan Burklow. Bryan, you have over 25 years experience within the healthcare industry and about 15 years experience as a chief executive officer for a number of large hospital networks. Can you kind of give us a brief overview of your career and really how you got involved in this type of work?
Yes, Gary. It was a passion of mine early on, right out of college, to get involved with hospitals. And so I started working in the finance side right away, had a finance degree from undergraduate, and just fell in love with running hospitals and being part of a system where you're working with doctors, treating patients, making people feel better. And it was just a great thing to get into at the time. There's always a need for hospitals, and I think that as outpatient care's grown and now telemedicine, that probably some of the services and demand will be a little different moving forward for hospitals. But it was just a great place to cut my teeth in the business and learn how to deal with doctors, a lot about medicine and healthcare. And so I started in a small system, worked my way up to regional vice president by the time I was 34 years old, and over 5 hospitals in California. And I just really enjoyed it. I've got to learn about all the nuances, the rules, working with medical staffs, and all the regulations are pretty complex. I tried to master that. I think I've done really well with it. And I'm very proud that the hospitals that I've been involved with have just done incredible jobs in their community. The leapfrog studies, safety surveys have gotten better, and we've provided quality care and saved a lot of lives.
So just continuing with the experience you just described there, in managing these large hospital systems and networks, what were some of the major accomplishments or points of pride from your career?
Great question. And so there's 3 or 4 things that really come to my mind as highlights in my career running hospitals. One was I was involved with a hospital in the early 90s when the AIDS crisis was pretty big and prevalent in California and throughout the country. And I was running this hospital in West Los Angeles. And at the time, AIDS was still fairly new and people were pretty scared. They didn't know how to get treatment. Hospitals were turning some of these patients away and not treating them very effectively. So I got together with several key physicians in the West Los Angeles market, and I talked to them about a vision of basically converting our whole 4th floor of Midway Hospital Medical Center into an AIDS unit. And there was nothing like it in Los Angeles or the country for that matter. There were just little small units, but this was actually a 44-bed unit with dedicated physicians and staff. And we pioneered what became a really model program throughout Los Angeles and at my hospital in West Los Angeles. And we wrote a paper on it. The care was so good that the White House came out to look at it, and we became a model program in the country. So it was just fantastic. And it was such an accomplishment to be part of a team and working with class doctors that were so quality oriented and dedicated to patients that were victims of AIDS. And it was just remarkable. Another thing that comes to my mind that I'm very proud of is that I really, over the last, say, 6 to 7 years, have become an expert, I'd say, at turning around hospitals. Always good at running them, but taking struggling community hospitals that were poor quality, losing medical staff, losing market share, and trying to fix them to keep the patients local, make sure that those people that were there get the best quality care, and that by improving the quality and focusing on improving the medical staff, the service lines, and fixing equipment and staffing shortages, putting it all together and improving the quality did in fact improve the finances. And so I have several successes, but one that's the most makes me the most proud is my turnaround at St. Michael's Medical Center in Newark, New Jersey. That's a hospital that had gone into bankruptcy. The state had given up on it. They wanted to close it down. And we took it over and turned it around and took it from a Leapfrog F hospital to an A. It's now a CMS five-star hospital. And it went from losing $24 million a year when Trinity Health managed it to us taking it over. And 3 years later, it has a $18 million profit and 11% operating margin. So it's just, and that community is so proud and pleased that we were able to accomplish this in a 3-year period.
That's very interesting. And I'd like to go back to actually what you said about revamping these hospital systems. In the process of that revamp effort, I mean, how much of that is purely financial versus, revamping the staff and the leadership of the hospital itself? I guess more generally, what's your typical approach when you're tasked with a job like that?
Well, I think that operating efficiencies have gotten better and better across the board. I think that there's enough consultants and literature out there that I think that staffing is not that much different. People are all systems are using some form of group purchasing. So I think the operating margins in terms of just operating efficiencies are probably not as important as it once was maybe 10 years ago. But I think the change that I noticed while I've been running these hospitals and trying to turn them around is the importance of basics like cash flow, managed care management, and really looking at the clinical performance. So I think that it's kind of shifted from operational efficiencies to clinical efficiencies, being more consistent in physician orders, not overutilizing services. Also looking at, managed care contracts and making sure the language doesn't get you into denial and downgrade capabilities, and then managing that process of what I'll call denial management on a 24/7 basis. I think that as managed care organizations got to a point where they could start saving money and maybe putting up these roadblocks and barriers in terms of notification and technical, they throw up technical denials for not wanting to pay, that if you didn't do this or you didn't get approval or you didn't give them clinicals on time. So it really is challenging for hospitals because as much as we are 24/7 businesses, hospitals in general, they're not very good at, weekends, say processes such as, working, reporting back to insurance companies on a patient status on a Saturday night, so to speak.
Okay.
And a lot of times when you try to do that, the insurance companies aren't available either. But if you don't do the hoops, jump through the hoops and do it on a timely basis, then you're really going to set yourself up for less reimbursement. And I think that's the thing that's probably frustrating to leaders in the industry, is to say, just watch that, hey, we gave good care, we did a good outcome, but we're not going to get paid because there's some technical reason that we didn't jump through a hoop in a timely fashion, or a doctor didn't get back, answer a query fast enough. So I think that putting a lot of focus on what I'll call the clinical process management of care has almost surpassed, the efficiencies, because most people have gotten more efficient with the resources they have over time.
So, I think that pretty much brings us up to EntelMed and really the contributions that we can make to the current healthcare market. So as CEO of EntelMed, how do you plan to actually build shareholder value in this rapidly evolving telehealth market?
Well, first of all, I'm very excited about telemedicine. I first started thinking about this years ago when I was running some what I'll call them suburban to kind of rural hospitals, and thinking that, we just didn't have access to some of the specialists that the big downtown medical centers had. So I always thought that there was a big need in the rural area for sure. But with the technology and now the potential to interface equipment for remote patient monitoring, being more prevalent and available, it starts opening up the the opportunities beyond what I would say the kind of the old schools approach, which was just maybe for rural hospitals or rural medicine. And I think that the other thing is that as care has gotten so expensive, going to emergency rooms and the urgent cares have proliferated. I mean, this is just a natural step. How do you keep patients, well and not sick? How do you address it at their home or their work environment? Time is pretty effective in terms of treating patients with disease. So trying to wait for a doctor's appointment or trying to, get yourself to an expensive emergency room that nobody's going to pay for, and the insurance company is going to deny it, saying you should have gone somewhere else. And then with some of the shortages in physicians in certain markets, it's almost impossible to go see a doctor on a timely basis. Many physicians in certain specialties in certain areas don't even have any new slots for patients. Mm-hmm. So it's pretty neat that we have this opportunity now with the technology and the growth of telemedicine to address some of these old issues that have just continued to fester in the healthcare system as we know it. Frost and Sullivan did a forecast recently that said that by 2025, that telemedicine and telehealth will grow by 7-fold, which is a 5-year compounded growth rate of over 38%. Yeah. So this market is huge. The opportunity is huge. And so I think that, how you build shareholder value is you have to, build an efficient system. You have to make sure that you're creating value for the patients and the physicians that want to use the service. You have to have it so that it's timely, it's cost effective, it's easy to use. And I think you find your niche and in this business, and there's so much opportunity that it'll just, the shareholder value will come with the success of building patient volume and revenue growth.
So just kind of continuing that thread, I know we mentioned that access to doctors in remote or rural areas is a big challenge the healthcare industry is facing. Are there other major challenges that you think EntelMed could be instrumental in helping solve?
Sure. One of the things that the government's been trying to solve for years, and they didn't do it in a very effective way. I think they just did it more of in a penalty way, but, the readmissions. So basically patients get sick. We don't give really good value up front and trying to do preventative care, right? So a patient gets sick, they go see a doctor, the emergency room, urgent care, then we patch them up. We don't really monitor them that way. We put all the burden of that onto the patient and say, good luck and don't come back and take your drugs and meds and fix yourself and don't come and see us anymore. So what they noticed, the government, Medicare and the payers have all joined on this, is that, readmissions, this kind of, I'll call it patch and go method we've created in this country isn't very effective, and people get readmitted quite a bit, within 30 days. And so the government's answer was, and many payers too, we just won't pay hospitals, if they have a readmission on certain areas, certain diagnosis types within 30 days. And so it puts all the burden kind of on the hospital and not the patients necessarily, or the physicians for that matter. Mm-hmm. And so that hasn't really worked. And so with telemedicine and then remote patient monitoring, which can be done on a real-time basis, it starts giving patients a little bit of a crutch, so for the healthcare system to monitor them closely so that maybe they don't get readmissions. In fact, Geisinger Health Plan did a study, and they found that implementing telemedicine in certain areas reduced their readmission rate by 40% within the first 30 days. And I think it was 38% after 90 days. This is huge. So the benefits, I think, of incorporating telemedicine into care models is going to, in addition to, helping rural hospitals and rural care, is going to really improve, readmission rate and better outcomes, which is going to mean, more cost savings to our healthcare system and to, state Medicaid and federal Medicare budget. So I think it's a great opportunity for us. Just to touch back on the rural need, though, it is interesting that 20% of all the patients live in rural communities, and so that means that they don't have great access to care, and there's only 1 in 10 docs in these areas too. So when you look at a good chunk of Americans live in what I call remote rural areas, and they just don't have access to doctors. The benefit to telehealth is there and real, and it isn't going away. So I think that the challenge, though, has been, the infrastructure in terms of connectivity, whether that be, the internet or cell receptions and whatever. So that's been kind of lacking. But I think that infrastructure continues to improve year in and year out. And as equipment gets better, that makes the likelihood of giving better service in rural communities through telemedicine even more hope and more viability than it had been in the past. And I think that the other thing is chronic diseases. We have an opportunity to go out there and monitor patients on a real time, so that when they have these spikes, peaks or troughs of things, that we can address them, change their medications more effectively and more timely. And so I think that opportunity is going to continue to propel telemedicine utilization throughout the country.
It really sounds like a win-win for both the patients and the doctors, and I would imagine these approaches to healthcare are only going to become more and more popular over time. So in your mind, what do you think healthcare is going to look like in, say, 15 to 20 years?
Well, I think what we're going to see is that there's always going to be need for hospitals, but they're going to continue to take care of the sickest patients, and because that's what they're really designed for. Those chronic patients that need real sophisticated equipment, surgeries, and care. And I think that what we're going to start seeing is that less institutionalization of say seniors and patients with chronic disease, and more of taking care of them at home, which is more cost effective, right? And it's really what people want. So I think that I feel that at EntelMed, the opportunity for us is to try to do something unique. And the kind of the holy grail, as I see it in this whole space, if you will, is that take virtual visits, which a lot of people are doing. Try to take the remote patient monitoring aspect, to connect it. Some people are trying to do that also, but here's the key: is to make it so that they just don't have to leave home. You couple those efforts with home care and home health. And having people, nurses and techs that can go out to hook up these monitors, look at them, and you can put that in one package, and you really have it all, because you'll save money, you'll give great care, and you'll keep people out of institutions. So I think that's really where we're headed, is to more of using technology to lever patients to be, at home and better cared for, which is what everybody really wants, and you'll save money along the process.
Well, that sounds very exciting, and I greatly look forward to the progress that you're going to be making at EntelMed. And so in conclusion, I just want to say thank you for your time this morning. It was a great pleasure to hear about your background, your expertise, and really all the exciting advances that are being made at EntelMed. So thank you, Bryan.